There are many myths and misconceptions about hospice care. According to the National Hospice and Palliative Care Organization, many people believe hospice is only about dying and that hospice is the place you go when there's nothing more to be done. In actuality, hospice helps people with a life-limiting illness focus on living as fully as possible for as long as possible. The healthcare professionals at Cornerstone Hospice explain the services they offer and how misconceptions should not keep you or a loved one from utilizing their specialized care.
When folks think of Cornerstone Hospice, what they really need to know is that the scope of services we provide is designed to meet all of the needs of the patient who's facing the end of life. A lot of times folks think that they define us by what they think they have to give up, but they don't really realize that when a patient comes under our care, in addition to the nursing visits that we provide and the CNA visits, we also have physicians who can make house calls, and then all of the medications, the equipment, and affiliated services like chaplains and volunteers, all that's included as part of the hospice benefit. Yeah, another myth that folks have is that when they come on hospice care, it means that they just have hours or a few days left, that there's going to be some immediate end to their life. And what we let folks know is the hospice benefit is designed for the last few months of life, ideally. Because if we just wait till the last couple of days, that really isn't enough time to help someone prepare for the things that are going to be happening. If you look in the sense of the Medicare benefit, that's 6 months or less of life expectancy. But actually in Florida, the state law is that we can admit patients with a year or less life expectancy. And actually what we find over and over, we hear families who benefited from our service, and they say, you know, we wish we'd have learned about you guys sooner. We wish we'd have made this decision earlier. We could have had all of that support for a longer period, and this experience it was good, but it would have been even better. Part of our message that we're trying to get out to the community is have the conversation, help folks understand in your family what you want, what you don't want at the end of life, and make those preparations in advance and get access to the services earlier so that you can spend as much time saying goodbye and gathering your friends and loved ones around and make the most of the time that you do have, however long that is.
You'll find contact information for Cornerstone Hospice when you click the Specialized Care Story Link icon on our homepage, yourhometownhealth.com.